Are you having trouble losing weight? Have you been exercising, dieting, and you just feel like you've hit a wall? Do you have questions about GLP-1s that you see advertised on television all the time? My name is Dr. Eric Joseph, President of New Jersey Health and Wellness, and in our practice we help people that can't lose weight to lose weight. And we start by analyzing people's metabolism with a panel of blood work, including hormone levels, and when all is said and done, we utilize GLP-1s a lot. GLP-1 is a glucagon-like peptide. That's what GLP stands for. And it has effects on the brain, on the pancreas, which makes insulin, on the stomach, and it also has direct effects on the liver. So insofar as the brain goes, the GLP-1s increase satiety. So there's less food noise. People tend to think about eating less when they're on a GLP-1, which is good. So if you're craving food less and you're thinking less about food, you're going to eat less, and that leads to loss of weight. Unfortunately, the GLP-1s do act on the brain, and they cause a side effect of nauseousness. The way they act on the pancreas is they cause the islands of Langerhans cells to make more insulin. And so if there's any insulin resistance, this is how a GLP-1 helps with insulin resistance, by causing the pancreas to make more insulin. It works directly on the stomach by decreasing gastric emptying time, which means food stays in your stomach longer, so there's more of a sense of fullness and satiety. This is why it's very important to discontinue a GLP-1 at least 2 weeks before undergoing an elective surgery, so that there shouldn't be any stomach contents during intubation. And the GLP-1s work directly on the liver to increase insulin sensitivity. So the pure GLP-1 that we prescribe is Semaglutide. The brand name for this is Ozempic or Wegovy, and some patients respond ridiculously well to it. The other GLP-1 that's also a GIP agonist is called Tirzepatide, and that is more commonly known as Mounjaro or Zepbound. GIP is a glucose-dependent insulinotropic polypeptide, and that is one of the properties of Tirzepatide. So not only is it a GLP-1 like Semaglutide, but it also is a GIP. And what does a GIP do? Well, I think it makes for a better weight loss drug in general with fewer side effects. So a GIP also decreases food noise, but instead of increasing nauseousness, it decreases nauseousness. So clinically, we have seen much less nauseousness in our patients that are on Tirzepatide instead of Semaglutide. The GIPs also cause the Isles of Langerhans in the pancreas to increase their production of insulin. And additionally, the GIP property of Tirzepatide increases insulin sensitivity and also decreases inflammation in the body and in the cells. There's also thoughts that Tirzepatide or GIPs can increase insulin sensitivity in skeletal muscle. So whenever we start somebody on a GLP-1 or a GLP-1 GIP agonist like Tirzepatide, we always get an in-body test. We check people's skeletal muscle mass, percentage body fat, visceral fat. We start them on the medication, and we have you come in and see us once a month or so to make sure that your weight loss goals are being met satisfactorily and that you're not losing too much skeletal muscle mass. I hope that you found this content interesting, and thank you so much for watching.